to the second half of our lecture where we're discussing superficial thermal agents. In the previous lecture, we discussed cryotherapy, some of the hemodynamic effects, neuromuscular effects, metabolic effects, indications, contraindications. We're going to do the same thing here for thermotherapy. So let's just jump right in. So when we look at thermotherapy, these are some of the hemodynamic effects that we're going to see after application of something like a hot pack to our patients. Anytime that we apply a heat pack to the area, any type of heat at all, we're going to see systemic vasodilation, which helps to increase blood flow to the surrounding tissues and therefore also enhances oxygen delivery to those tissues. We also see a removal of metabolic waste products. So this basically flushes out any waste products such as lactic acid that may be contributing to this chronic inflammation. So we kind of we kind of restart the healing process all over again with the removal of those metabolic waste products. We're also going to decrease blood viscosity, heating it up, decreasing any risk for clotting, things like that. We're also going to see increased capillary permeability whenever we apply heat to an area. And this is why we talked about in class how we're not going to apply heat to an area where we apply something like a capsaicin cream or anything like that, because it actually can increase the uptake of that specific topical that you're putting on your patient. So what does that mean by increasing capillary permeability? Well, it makes the walls of the small blood vessels more permeable, allowing for easier exchange of nutrients and waste between the blood and the tissues. So it's a really good way, again, to kind of open up those blood vessels and allow for more nutrients to enter into the area, enhancing tissue healing processes and things like that. The next one down, we're increasing cardiac demand whenever we place any type of hot pack to an area or any type of thermotherapy. We're increasing blood flow, which means the heart has to work harder to circulate that blood and to meet the needs of the body. So you want to be really cautious for somebody who has heart failure of any kind, because increasing the workload on an already overloaded heart can be not so good for your patients. And then we're also going to see this distant vasodilatory effect. This is really interesting because whenever you apply a hot pack, let's say to somebody's lumbar spine, you're also going to get a distant vasodilatory effect, which means that you're going to increase blood flow to the distal extremities, even if that's not the target area. So for somebody who has really poor circulation, maybe in the distal extremities, you're not going to necessarily want to place a hot pack over that area because there's impaired circulation. They may not be able to effectively dissipate that heat to the tissues. So you're not going to want to place a heat pack directly over that area that's got some kind of vascular issue, but you can place a hot pack more proximally. You're going to get this systemic effect, therefore delivering tissues to other areas that may be compromised and don't have as well or as good of blood flow as some of these other portions of the body. Now we're going on to the neuromuscular effects. We've talked a little bit about this with our cryotherapy as far as nerve conduction velocity and firing rate. So with cryotherapy, we saw a decrease in nerve conduction velocity, but with thermotherapy, we're actually going to see an increase in the speed at which nerves transmit signals and affect the firing rate. So you're going to see increased motor neuron response with the effect of thermotherapy. We can also use heat to help decrease muscle spasm, just reducing muscle tightness, relaxing muscle fibers, but also kind of decreasing this what we call reflexive muscle guarding that you may see with your patients. So anytime after there's an injury, there is likely going to be some type of muscle guarding that your patient is going to exhibit. And it's really hard to get past that as a clinician. It's hard for them to let go and let you take control while you're moving their arm through passive range of motion or something like that. But maybe if they're not in that acute inflammatory phase, we can improve or at least decrease that muscle guarding and improve their range of motion by applying heat to that area. We also see increased pain threshold with the application of heat, very similar to what we discussed in the previous lecture with cryotherapy. There's some of that gate theory of pain control by introducing a non-noxious stimulus to the area to help improve or decrease their pain sensation. Another thing that we talked about in lecture was also that we see this vasodilatory effect, and that decreases the risk of ischemia in certain tissues because we're improving blood flow. So there's a lot of times patients will feel pain because of some type of ischemic issue. The muscle is not getting blood flow, it's not getting oxygen, therefore we feel it as a cramp, we feel it as pain. So if we can reverse that trend and actually get more blood flow to the area, reverse that ischemic type of event, then we can also decrease pain. Something that we're going to use heat for quite often in clinical settings and in our labs is to help improve tissue extensibility and flexibility. So this application of heat increases elasticity of soft tissues, such as muscles, tendons, and helps improve flexibility while reducing the risk of injury during some of our stretching activities. So it's really good pre-stretch activity. It's also really good to use concurrently. So applying the heat pack to, let's say, your hamstrings, and then stretching the hamstrings with a prolonged stretch to maybe help improve long-term range of motion and flexibility. The last bullet here, changes in muscle strength. The application of heat may temporarily alter muscle strength due to its effect on nerve conduction, as well as relaxation. So you may see, initially a decrease in strength just because you're getting that muscle to relax. But with the, with the nerve conduction velocity increasing, you may also see after some time increased strength gains, especially compared to cryotherapy. So let's move on to the metabolic effects now. We spent a little bit of time here in class looking at this, but some of the metabolic effects that we see is increased metabolic rate in those specific ranges of 102 to 109 degrees Fahrenheit. So this enhances cellular activity, promotes healing, and all these different repair processes that we're going to talk about in the upcoming chapter for tissue healing. And that's why it's really good to apply heat to something like a chronic type issue, because again, it's going to only enhance cellular activity. You may also see proteins denature at pretty high temperatures above 113 degrees. So you'll see these enzymes and proteins breaking down in the body. This can lead to tissue damage. So this is actually not a benefit of thermotherapy, but something that could be an adverse reaction that you'd really want to pay attention to. As we've talked about before many times in the past already, excuse me, heat should not be applied over areas of inflammation. With this thermotherapy, you're going to see increased vasodilation, which only increases blood flow, maybe even delivers more of those different chemical mediators, histamines, things like that, that would only exacerbate, edema in the distal extremities where we don't want to see that. The next bullet point down too is pretty interesting. Hemoglobin releases more oxygen when temperatures increase. So basically what's happening here is the hemoglobin in the blood is releasing more oxygen. It's making it more readily available to the tissues. And again, this helps to support enhanced cellular function and healing. So if we want more oxygen to the tissues, thermotherapy, applying a heat pack, is going to be a really good way to do that. We're trying to enhance that cellular function. We're trying to increase tissue healing time, which leads to the last bullet point here, which it can accelerate tissue healing for chronic issues. So if you see any of our case scenarios in the future, exams, quizzes, things like that, if you see questions that are related to, thermal agents and it's a chronic issue and you're trying to accelerate tissue healing, immediately your mind should go directly to thermotherapy, so much cryotherapy. Now we're also going to talk a little bit about how thermotherapy can alter tissue extensibility. As we mentioned earlier, we're going to use thermotherapy quite a bit to help increase tissue extensibility. When it comes to stretching, range of motion, things like that. As PTAs, this is a big component of our treatment sessions on a daily basis, regardless of what setting you're in. So we're going to be trying to increase flexibility, mobility for our patients, and if there are no indications, maybe applying a hot pack to the area beforehand, maybe even doing something like sauna beforehand, or educating your patients on the use of sauna, hot showers, things like that, can really help improve their shoulder range of motion. That was something that while I was still in clinic, I would tell my patients that all the time. If you're going to work on mobility and stretching, maybe take a warm shower. That'll decrease the stiffness in your shoulder, and it may actually help those tissues lengthen permanently. So speaking of that, the next bullet point down, we talk about plastic deformation being achieved after heating. And what plastic deformation really means is that you're going to have this permanent change in tissue length after this application of heat with or concurrently with this stretching for long periods of time. So typically, you're going to stretch your hamstrings for 30 seconds to 60 seconds. And then you're going to maybe take a break and go through a next set, next round. Whenever we're trying to induce plastic deformation, especially for somebody who has a joint contracture or something like that, we're going to really need to apply not only the thermotherapy, but the stretch for a longer period of time. So as our tissues heat up, they become more elastic. Then we're going to place those tissues on stretch. And after they cool off, we're hoping that they maintain that stretch. That'd be like the plastic deformation that we're discussing here. The optimal tissue temperature for achieving plastic deformation is around those ranges of 104 to 113 degrees Fahrenheit. Just remember, after we get above 113 degrees or around that zone, we start to see those proteins and enzymes denature, causing tissue damage. So we really have this sweet spot of 104 to 113 degrees. Now I have this question at the bottom of this slide here: which modalities would be appropriate for joint capsule tissue extensibility? So we have to just remember here that we're talking about superficial heating modalities, and for something like a joint capsule, that's typically not what we think of as being superficial tissue. This tissue is usually much deeper, so it depends on the joint you're looking at, obviously. But if you're thinking of the shoulder, we have our deltoids, we've got our rotator cuff muscles, our pecs, all these different parascapular muscles that are going to cover and surround that joint capsule. So applying, hot pack to somebody who has adhesive capsulitis, frozen shoulder, that may not actually heat the tissue that we're looking at or that we're discussing here, such as the joint capsule. It may do well for your patient by decreasing their pain and for improving, some kind of range of motion, but it's not going to target the actual capsule of the shoulder because that's deeper. So we would need something like a deep heating modality. And even then, when we use something like ultrasound, thermal ultrasound or diathermy, there's still a limit to how deep we can heat. Okay, so just always think about that. But there's going to be certain questions on your exams that ask questions just like this: which is the most appropriate for this scenario? So we'll get really used to that soon as you start to get into your exams and all your tests and quizzes. So here's some of the indications for superficial heat. As we talked about earlier, pain control, decreasing ischemia, increasing pain threshold can do really well to help control pain. We're also trying to just help the muscles relax, reduce spasms, things like that. Just remember that spasm and spasticity are not the same. We're going to talk more about spasticity when we get into our neurosections, but muscle spasm is not the same as spasticity. So just keep that in the back of your heads until we get later on in this semester. We're trying to improve circulation. If somebody has decreased circulation in the area, we're going to use thermotherapy to help increase circulation. We're also going to use it in instances where our patients have chronic inflammatory issues and conditions. So we can, again, try to enhance cellular function, get rid of that metabolic waste by applying a hot pack to the area. And of course, like we mentioned a few times already, trying to increase range of motion. So if they have decreased range of motion, and we're going to work on them, we're going to try to get their shoulder flexion to 180 degrees from 150 degrees. It's probably best to try to heat that tissue up somehow, either through active exercise, warm up, or both a warm up, active exercise, and something like a hot pack. Also helps to really decrease joint stiffness. Here is another slide that you need to pay attention to for sure. Contraindications and precautions for thermotherapy. So let's look here. Recent or potential hemorrhage. If somebody is, if you see bruising on the skin, something along those lines. If you see purpura in the area, which we talked about with long-term use of NSAIDs, then maybe thermotherapy isn't the best bet for them, because we're increasing blood flow to those certain areas, increasing the risk of potential hemorrhage or severe hemorrhage. If somebody has a fever, then they have an increased metabolic rate already. You've all learned a little bit about the immune system and why you see fever whenever you're introduced, or your body's introduced to certain pathogens. So we don't want to necessarily increase fever by applying more heat to the area, increasing more of that metabolic activity. Thrombophlebitis and DVT, you should definitely star and highlight that one. Anytime that you are suspecting of a DVT in your patients, first of all, you shouldn't be doing hardly anything except for picking up the phone, calling the physician, calling their specialist, at minimum, telling the supervising physical therapist about it. Just remember that, if somebody presents with a DVT, so let's talk about what that looks like in the lower leg. If somebody presents with severe redness, swelling, the skin looks tight, very red, that's something that is going to be alarming. If it's painful, we'll talk about what a positive Homan sign looks like. We'll talk about what the Wells criteria for scoring the likelihood of a DVT is. There's a lot of different steps that you can take to kind of make your best clinical decision on whether this person has a DVT or not. But guess what? As a PTA, it's not our call to say that. So if we see those signs that I just mentioned earlier, the best thing for us to do is go to our supervising PT, terminate everything that we're doing with that patient for that day. Because remember, if we put thermotherapy on it, if we exercise, if we do range of motion, if we do massage, there's a chance that we can dislodge that blood clot, and it can embolize to the heart, to the brain, and that's something that we don't want to do, because that is a serious issue, and mortality rate goes up significantly when those blood clots embolize. So big one there, star it, make sure you know that, make sure you know what the presentation of a DVT looks like, especially in that lower leg, because that's where you're going to see them most often. We'll also talk about in therapeutic exercise just different risk factors for DVTs, but we'll get there. So don't worry about it yet, but just know the importance of it for now. Also, if we have acute inflammation, we're not going to apply a hot pack. Same kind of goes with the fever. We're not trying to increase metabolic rate any further. The next one down, devitalized tissues. Basically, if you think of necrotic tissue, that's what we're talking about here. But that kind of tissue it lacks normal blood flow, can't dissipate heat effectively, and this increases risks of local burns. So we're not going to apply any thermotherapy over any kind of devitalized tissue or necrotic tissue. If your patient has PVD, you want to be really, really cautious with applying heat to an area. for similar reasons that we just mentioned. Heat may not disperse properly for somebody who has impaired circulation, right? We kind of talked about convection and kind of heat transfer and how our body uses that to maintain temperatures. Like if our blood or a certain area of our tissue is heating up too fast, our blood is coursing through our arteries and our veins constantly, and it is helping to maintain, a normal temperature in those tissues so that we don't burn, so we don't have any kind of risk of frostbite, things like that. So be really cautious with your patients with PVD. Like I said earlier, you can go proximal to the area because this thermotherapy does have a systemic effect. So if somebody has PVD and they have poor circulation in their foot, you're trying to improve circulation in their feet, then maybe put the lumbar pack or put the hot pack on their lumbar spine. Let that distant vasodilatory effect take place and enhance oxygen delivery to that area without placing the hot pack directly over it while you're increasing risk for burn there. So just be cautious with PVD. Impaired sensation or mentation, we're going to figure that all out whenever we're doing our sensation testing. If they fail a bunch of our sensation tests during not the evaluation, but during your portion of the session where you're just seeing if they're appropriate for these modalities, then we're not going to apply it there. Mentation as well, if they can't tell you that they're burning because they're not physically or mentally capable of doing that, then there's no way that we can apply a hot pack to them unless we're sitting right there with them for the entire time and monitoring them. Next one down, malignant tumors, big no-no. We don't want any type of tumor to metastasize based on increasing that metabolic rate. So any history of cancer, any tumors in the area, you want to definitely make sure to ask those questions. And if yes, then we're not going to apply a hot pack there. Last one, denervation or surgical repair. Denervation is basically, what happens whenever you see some type of peripheral nerve injury. And we'll talk more about what that looks like, especially when we get into our E-stem chapters here and we're talking about NMES and Russian stimulation. We're going to spend a whole lot of time talking about denervated muscles and things along those lines. But if there is damage to a nerve or there's surgical repair of a nerve, then you're going to punt away from this one. You're not going to want to perform any type of thermotherapy, as heat may not be tolerated well in areas where nerve function is compromised, or if there's a recent surgery to repair a nerve. So we're going to just kind of punt away from that one. We're going to move away from thermotherapy in that instance. Now let's look at some of the adverse effects of thermotherapy. So the obvious ones, burns and skin damage. That's why we're going to come back every 5 minutes. We're going to check the skin, before, during, after to really see if there's any changes in the skin, post-treatment compared to pre-treatment. Increased inflammation and swelling, which is why we're not going to place a hot pack over something that's already inflamed. You may also see fainting via decreased blood pressure. Just remember that we're opening up these arteries, right? We're vasodilating. We're getting blood flowing to certain areas in the body. And especially if you're going to be putting somebody in like a supine or a prone position and then taking that pack off and having them sit up right away, we're going to talk about orthostatic hypotension in a lot of detail in multiple classes across this entire program. And what OH really is that significant drop in blood pressure, 20 millimeters of mercury systolically, 10 diastolically, with positional changes. So they go from prone, they go from supine to sitting, their blood pressure drops very quickly. They're at risk of fainting, at risk of falling. Especially, now add the fact that you're already opening up these, you're already vasodilating more, so they may have an increased risk for fainting, especially if they do have OH-like symptoms, even without thermotherapy. So really need to watch out for that. Just guard your patients very carefully. Ask them if they feel dizzy, faint, anything along those lines after positional changes. Next one down, bleeding. That's why we are going to avoid placing a hot pack over any type of hemorrhaged area, purpura, things like that. Increased risk of infection is again something that we'll talk a little bit more about whenever we get into more detail with the immune system. And then these next ones are something that you really need to pay attention to. Heat intolerance. So these diagnoses specifically are ones that you need to pay attention to. So patients with multiple sclerosis, MS, these patients are very heat sensitive due to impaired nerve function in the demyelinated nerves. So they're not going to tolerate heat very well. They're going to fatigue very quickly, especially if exposed to heat. So they typically need to be in a cooler environment. We'll also learn later on that, the earlier in the day, probably the best for our patients with MS. As the day goes on, they tend to fatigue easier, especially in the summertime. You also need to really pay attention to your patients that have diabetes, especially with something like peripheral neuropathy, because this can cause reduced sensation. Distally, it can cause poor circulation due to vascular complications. So a lot of different reasons why you'd want to pay attention to your patients that have diabetes. Poor nerve function, number one. Poor circulation, number two. Both kind of yellow, red flags for applying any type of heat therapy. Next one is hyperthyroidism. So we've talked a little bit about what the function of the thyroid is, what its job is, kind of in that endocrine system. But just remember that the patient that has hyperthyroidism has an increased metabolic rate already. Their metabolism is going through the roof. And then we're going to apply heat, which would only increase that metabolic rate. So they're going to have increased sensitivity to heat. So it's not like a complete no, but you want to at least be aware that this person may experience more adverse reactions, more so than the other patients on your schedule. The last one here, systemic lupus, is something that you need to pay attention to, SLE. So this is a systemic inflammation autoimmune disease already. So if there's this inflammation present in the system, there may be a likelihood that this person's not going to tolerate heat very well. They're going to, again, fatigue very quickly. So these aren't a 100% no's, like you cannot do them. They're not contraindications, but you need to take extreme caution with these patients. So here's some of the different types of thermotherapy. We've used a few of these in our lab setting. You can see on the top left-hand side, a nice little cervical hot pack. You should be pretty familiar with those. Top right is the paraffin wax, and this is the painting technique. So we didn't do that one. We used just the regular kind of technique for our, the paraffin and dipping our hands in there. But both really good. Those are the ones that you're going to see most in our lab setting. You can see the infrared lamps on the bottom right. In the middle is what we call contrast baths. So moving from a cold water basin to a hot water basin and kind of back and forward, trying to get the benefits of both thermo and cryotherapy. And then the one on the far right, kind of space in my mind on what they call that, but fluidotherapy, I think is what it's called. Don't bash me in the comments if I'm wrong on that one, but basically, you put your body part into this nice little machine here, and it basically circulates sand or something like that, and it moves very fast, and it creates lots of friction around your extremity that's in there, and you can see that the extremity is covered by a protective covering, but that also heats up the tissue as well, and I've seen a lot of occupational therapists use those in a clinical setting. So just a few different types of thermotherapy, not including sauna, steam rooms, or anything like that. Really quickly, let's talk about some of the documentation. So CPT codes for cryotherapy and thermotherapy, CPT code 97010. You're going to build this one for both hot packs and cold packs. you can see that the billing type is untimed, so you can only bill this one time per session. And then you can see some of the common usages over there. But if you go down to the next line here, CPT code 97124 is what we call massage therapy. And if you're billing this one, Medicare is not going to reimburse for massage therapy. And we'll talk more about why that's the case later on. But there are quite a few of these private third-party insurance companies that will pay for massage therapy. And the way that you word your billing practice, or the way that you word your documentation is really important here, because we can use ice massage and bill it as massage therapy. This is a times code, so we'll talk about the rule of eights and the kind of relevance of 15-minute increments, but we can bill this more than 1 unit per day, as opposed to something like the hot pack or the cold pack application 97010. So we'll talk a lot about that, but I just want to get you guys familiar with what some of these CPT codes look like. I want to start getting you familiar with the rule of eights and what it means to have an untimed code versus a timed code and those kind of things. So we'll talk more about this, later this semester, into semester 3, into semester 4, into semester 5. But the majority of where you're going to learn about this is in the clinical setting. And then there's a few case studies here that we're going to go over in class. So be ready for those ones.